Hi everyone, welcome to my channel. It's been raining quite a bit where I am, and it felt like the perfect time to cozy up and make another video. Today's video is a brief overview on upper cervical instability, including things that I've learned along the way. I've also included references and resources for your review. Let's get started. Let's start reviewing some anatomy so that the terminology we're learning makes more sense. So here we see the skull and the cervical spine colored in green. There are 7 vertebrae in the cervical spine. And vertebrae is just a fancier name for bones of the spinal column. We have 7 vertebrae shown here. And often you'll see a C written in front of each number, where C represents the word cervical. And the occiput bone at the back of the skull is C0. C1 is also called the atlas. Interestingly, in Greek mythology, Atlas was a titan who was condemned to bear the weight of the heavens on his shoulder. So I like to think of the atlas as supporting or bearing the weight of the head, and that story helps me remember the name of the bone. C2 is also called the axis. Now that we know the names of the vertebrae, let's talk about the joints they make up. So some parts of these bones touch together or articulate so that movement can occur there. These are joints, and they're held together by important ligaments and have specific blood and nerve supply. The occiput C0 and the atlas, or C1, forms the atlantooccipital joint. This isn't the best image to show the joints, but this is where they are located, generally speaking. The primary movements at this joint is flexion and extension, like when you nod your head up and down or nod yes. The C1 atlas and C2 axis form the atlantoaxial joint, hence the name. And the primary movement at this joint is axial rotation, like when you turn your head to the left and then to the right, or nod no. You might also hear the term craniocervical junction or CCJ being used, or the term upper cervical instability. And the CCJ, or craniocervical junction, refers to these 2 major joints we've talked about, from C0 to C2, the atlantooccipital and the atlantoaxial joints. The CCJ is a complex transition from the skull to the spine. And this upper area of the cervical spine functions differently from the lower neck because it's built differently. There are unique ligaments here, and the bones fit together differently in the upper cervical spine. The main ligaments holding the bones together in this area include the alar, the accessory ligaments, the cruciform ligament, which includes the transverse ligament, and the apical ligament, amongst others. And here is an image to show you just how complex this area is in terms of ligaments. You can see an example of the alar ligament here, as well as the transverse ligament. So these upper cervical ligaments that you see here are so important for stabilizing the upper cervical spine from our skull to C2. Although the cervical bones are small, the neck has the greatest range of motion in this area. The ligaments stabilize our head, and they allow and restrict movement in certain planes of motion. I'm going to include links to other anatomy websites in the description box below. I found websites that have beautiful pictures and really helpful videos of these important ligaments in action if you want to learn more. Now that we have a better understanding of some key anatomy, we can ask ourselves, what is atlantoaxial instability, AAI, versus Craniocervical Instability, CCI. Both AAI and CCI mean that the ligaments and or the bones in our upper neck are injured in some way and things are starting to move around too much and are causing some pretty serious issues. CCI refers to instability in any part of the craniocervical junction. So I like to think of CCI as the broader umbrella term, whereas AAI, or Atlantoaxial Instability, specifically refers to instability at the atlantoaxial joint. Very rarely, bone fractures are the reason that people have instability in the upper neck. More often, the bones are intact, but the ligaments are loose, and we saw a picture of those ligaments earlier. There's a lot going on in the craniocervical junction area, so when your ligaments are loose, it's not a good thing. This area is composed of bony structures, ligaments, muscles, and provides entry for the spinal cord and cranial nerves. It's also nearby to critical blood vessels that supply the brain, like the vertebral arteries. Injury to this area can be quite devastating. When the ligaments are too loose, it's difficult to hold the weight of the skull and things start to move around too much. For instance, very important nerves start to get irritated, there can be wear and tear on the joints over time, and there can be compression of blood vessels or even the brainstem. In serious cases, death can occur. What is the etiology or the causes of upper cervical instability? The number one cause is trauma, which can include a blow to the head from a fall or a car accident or a whiplash type injury. Number two is collagen deficiencies that people are born with. So this can include conditions such as Ehlers-Danlos syndrome, where people are born with connective tissue that is stretchier than usual. People with Down syndrome can also experience instability in parts of their neck as well. The third category is including other processes that are inflammatory, like rheumatoid arthritis. And rheumatoid arthritis tends to affect the atlantoaxial joint. There is also new research as to whether other conditions like viral illnesses like COVID-19 can cause upper cervical instability in patients. So that's a newer area of research that we don't fully know the answers to yet. With upper cervical instability, or CCJ instability, patients can present with so many symptoms, including neurological ones like headache, vision changes, or brain fog. And this makes sense because we think of how complex the anatomy is in that region and how much can go wrong when things aren't working properly. The top 5 symptoms reported for this condition, as written in a book by an MD specialist, which I'll link below, include headaches, upper neck pain, dizziness, imbalance, lightheadedness, brain fog, and clicking and popping sounds in the neck. But there are so many other symptoms that patients can present with, like fatigue or a fast heart rate, which is also called tachycardia. People might also have vertigo, which is when the room is spinning around them or they experience a spinning sensation, or tinnitus, which is ringing or buzzing in the ears. They might also feel like a bobblehead or that they can't hold their head up. And there are so many other symptoms that patients can report. Patients can also range in how functioning they are, depending on the severity of their symptoms. Some patients might be homebound, bedbound. Some patients might be able to work, so they might be mildly functioning, and some patients might be highly functioning, so it's very dependent on the person. In terms of diagnosis, there is no one-size-fits-all protocol yet for diagnosing upper cervical instability. My understanding is that there are many different puzzle pieces that doctors and specialists will look at, like the patient's history, symptoms, physical exam, and imaging. Highly trained doctors and specialists like neurosurgeons can make this diagnosis. From what I've read, different doctors might have different ways of getting to a diagnosis, so they might use different lines of evidence to reach their conclusion about a patient. In terms of imaging, some examples include a digital motion X-ray, a CT scan with movement, or special MRIs that are movement-based. There are specific measurements or signs that a specialist or doctor will look at on imaging to see if something is not working well or if there's too much movement going on. I've included a link to a comprehensive book written by an MD specialist that goes into so much detail about the types of imaging that are required to reach a diagnosis. I found it very helpful personally, so I'll link that below. In my own life, I've also started to keep track of the imaging that I've received to monitor my radiation exposure. Just in case you're wondering, CT scans and digital motion X-rays subject patients to ionizing radiation, but things like MRI do not. So I found it helpful to ask my doctor questions about my radiation exposure throughout my diagnostic process. And again, I've linked a book below, which is the only reference I could find thus far that is a comprehensive overview of this condition and the diagnostic criteria required. In terms of treatment, there are different levels of care. And the first level of care is conservative care, ranging all the way up to surgery, so increasing in invasiveness. Conservative care includes physiotherapy to strengthen muscles, for example, in the neck. There can be very specialized chiropractors that can help patients with upper cervical instability, like NUCA or Atlas orthogonal chiropractors. In terms of injections, there are so many different types that are less invasive to those that require highly specialized equipment to access the right areas and prevent serious damage. So it's very important to discuss regenerative medicine, such as injections, with your doctor and make sure that they're qualified to perform these procedures. And the last level of intervention is surgical fusions to stabilize the skull to the upper neck. Overall, there are various terms that refer to upper cervical instability, and we learned that craniocervical instability refers to an umbrella term of instability in the craniocervical junction, whereas AAI is instability specifically at the C1-C2 joint. And I've also discussed the causes of instability, the symptoms, as well as the diagnosis process and treatments. And this is just a compilation of the material that I've read, and I wanted to include all the references and resources I used in the description box below, which are written by specialists and doctors, and they go into so much more detail. And again, I'm not a doctor or a healthcare professional, so please consult with your own healthcare team before making any decisions about your health. When I first heard of upper cervical instability, I looked everywhere for videos like this that were just a brief overview, so I hope that this is helpful to you and guides you into the right direction in terms of resources. Have a great day.